Hi, I'm Frank Chen. I'm a psychiatrist in the Houston area. I have been the chief medical officer of a hospital locally called Houston Behavioral Healthcare Hospital, as well as my private practice, Houston Adult Psychiatry.
This is Dr. Lorenzo Norris, Editor-in-Chief of MDedge Psychiatry. Today, we're pleased to have Dr. Chen with us, and we're going to be talking about our patients that we treat who have schizophrenia and trying to think about really how our patients with schizophrenia are dealing with the COVID-19 pandemic. There have been some studies that have come out that have made us start to shed some more light in regards to the inherent risk that our patients with schizophrenia face from COVID-19. And we're going to also think about how our schizophrenic patients with COVID-19 are coping through the pandemic. So please stay with us as Dr. Chen guides us through this discussion of thinking about, really the clinical aspects of schizophrenia and COVID-19 as we're facing them every day. Dr. Chen, welcome to the Psychcast, sir.
Thanks for having me.
So, Dr. Chen, I was really glad to have you here to, as a person being on the front lines, working with our patients with schizophrenia, and to talk a bit about schizophrenia and COVID-19. And where I wanted to start, Dr. Chen, is there was a recent article that came out of JAMA in regards to the associated psychiatric disorders with mortality among patients with COVID-19. All right. And that article had a number of interesting things, but particularly as it related to patients with schizophrenia spectrum disorder. In particular, the article got to the idea that a diagnosis of schizophrenia spectrum disorder may be a risk factor for mortality in patients with COVID-19. Dr. Chen, I was wondering if you could just maybe talk to us a little bit about your thoughts about that article and how you maybe should start to look at it and interpret some of that data.
Sure. It's certainly concerning that our patients with schizophrenia seem to have the second highest risk group in terms of mortality from COVID next to age. And we want to kind of examine that. As we all know, patients with schizophrenia have earlier mortality rates, partly because they can't adequately care for themselves. They don't do some of the preventive medical care that we would be accustomed to, but also because they're on antipsychotic medications that may predispose them to metabolic factors, diabetes, hypercholesterolemia, that shorten their lifespan. But I want to explore the environmental factors that may be challenging to individuals with schizophrenia. While most individuals with schizophrenia would naturally social distance if they can, quite a bit of our population reside in places like group homes where they are in a very crowded situation. Our patients are also not very good at following directions, and so masking may be a challenge for them. And so I do think that while leaving it up to them, they would hibernate in a room by themselves, but because of the challenges that they have from a social standpoint, they may be at risk for catching COVID and subsequent mortality associated with COVID.
Well, Dr. Chen, when I think about this, again, when the authors of this study, they're looking at this, they controlled for a number of things. And there had already been some studies out there that had shown that the increase, if you will, mortality broadly in mental disorders. But this, I believe, was one of the first studies where they were actually, once they controlled for the various comorbid factors, age, weight, and things of that nature, that schizophrenia itself was suggested as in and of itself, the diagnosis being associated with a higher risk. And I think you hit the nail right on the head, that there are some other factors that have yet to be accounted for, whether it's in the environment, in terms of what our patients face, as well as, because we talk about the environment, you talk about masking, you talk about social distancing in the quarters, but I also think about access to care. I absolutely think about access to care and ability to follow up. And this is not unlike what we would see in other medical populations, whether various populations. I think back to some of the work that I've done in psycho-oncology in the cancer survivorship world, in that it wasn't so much a lack of treatment, it was lack of access and able to get people to the care that they need. And we can certainly, with schizophrenia, particularly if we look at the cognitive dimension of it and the challenges at times with an executive function, we can see where that would be certainly a challenge. I would say that also thinking about this, that this brings up interesting questions about who should be vaccinated and at what time. certainly as we're doing the vaccine rollouts, and maybe we'll touch base upon that a little bit later. But again, for the audience, those of who haven't read the JAMA article, I want to say it came out January 27th, something like that, 2020, 21. I encourage everyone to take a look at that. Now, Dr. Chen, we're kind of thinking about schizophrenia spectrum disorder, and again, this idea of perhaps schizophrenia in and of itself, the diagnosis being associated with increased mortality. But we certainly know that many of the factors, or many of the things that are in the diagnosis of schizophrenia, or that our patients, the syndrome of schizophrenia, whether it's the access to care, the environment, can certainly leave them at increased vulnerability. Can you maybe now walk us through, though, where our patients with schizophrenia might actually cope? We might have unexpected, more robust coping than what we might even see in the general population. I'm curious about what you have to think about that, per se.
Yeah, so some of my patients who are not living in group homes, who are fairly well taken care of, because they're used to crisis and they're in their lives, they're used to, the thought that something fearful is occurring in the world. They may have adapted to sort of the news of the pandemic a little better than other people. It's not so much of a disruption to their lives because they're already kind of used to this level of crisis, if you will. And if you do have individuals who have their own rooms, for instance, they naturally would hibernate, and they don't care about interactions if you leave it to their own devices. So in those situations, social distancing and isolation is not such a terrible thing. The individuals with schizophrenia who have access to the internet, or they have caring family members who brings the internet to them, they actually get home visits as we explore telepsychiatry. As you know, Dr. Norris, the pandemic really just yanked the training wheels from telepsychiatry, and we went from the use of telepsychiatry in the rural setting and maybe in the prison population to being something that's the norm rather than the exception these days. And so just as with other patients that we typically see, we are making home visits with the individuals with schizophrenia. We get to see their environment. We actually, I actually can pay a lot more attention to them because I can actually jump into their lives once a week as a result of the ease of telepsychiatry. Whereas in the past, it may be very difficult getting them to an office. They may have transportation issues, but with this new modality of care in medicine, in psychiatry, we're making home visits, and we can see them much more frequently to make sure that they are adherent to treatment, to make sure that they're taking care of themselves, and to alert family members if we see concerning signs.
Dr. Chen, one, I might have to borrow that from you. Yank the training wheels off of telepsychiatry. I think Dr. Yellowlease was on the pod a couple of, probably maybe about 4 or 6 weeks ago or something of that nature, talking about telepsychiatry. But that's the truth. We have to yank the training wheels off of that. And I always look with fascination that, what was it, over a period of like 3-4 weeks, maybe a month and a half, like all of a sudden we just went to telepsychiatry. I mean, that's a really interesting point for all of us, that when we need to do something, we do it. Now, as you were talking about schizophrenia, our patients with schizophrenia, there's some really important things that struck me, that came to me. One, and it links back with the earlier discussion. You said it, family and support. Folks that have family and support, that can make, it's in anything, but that can make a huge difference. It makes me think about some of my patients who I've had the privilege of working with schizophrenia. And I'll tell people the difference in the outcome that was had as much, if not more, to do with the family support than it did with the medications. All right. Because that was there. The other thing that I think about is, and look, I am not a schizophrenia expert. I would be very interested in what Dr. Henry Nasrallah, editor in chief of Current Psychiatry and eminent schizophrenia expert would have to say about this. But I would be curious, Dr. Chen, what you said, perhaps some of our patients with the negative symptoms where they naturally might socially isolate and withdraw. So that can actually, in a context with support, work well in that situation. And then the other thing, what is it that people are, when we talk about quarantining and isolating, I think that, you know, I know for a fact, all you have to do is actually look at look at the news, look at any evidence base or whatnot. That wreaks havoc on the lives of everybody. But with our patients with schizophrenia, regardless of whether they, you know, depending on where they're at and how they've recovered, that isolation or the need to quarantine or deal with the crisis, as you said, could be a little bit more part of their daily life. So I do find it interesting that in this particular situation, again, but I'm going to focus on the idea, though, of support and access. I think in those contexts, our patients with schizophrenia, we can't overlook the ways in which they can show resilience in this pandemic. So I think it's just an important point as we think about all the, you know, everything that we're dealing with in terms of the death, the mortality, the suffering, that we have to continue to ask ourselves questions like, wait, how can I work with my patient to actually get, you know, to tap into wells of resilience I may not have been thinking of? And I love that example. You said you get to go into the homes of your patients. Like you get to really be in there. Can you elaborate just a little bit about that? Like just maybe some of the things that might have surprised you when you've been had been brought into the homes of your patients, so to speak?
Sure. Let me make a couple points about some of the things that you just brought up. And you know, going back to the concept of telepsychiatry, you know, I remember back in the early 2000s, I worked briefly in a correctional institute where we did telepsychiatry, and we were talking about you know, state-of-the-art technology then with you know, these huge machines that transmit video signals from one facility to another, right? And so you know, at some point the internet became more involved, and you know, we have things like FaceTime, but there are regulations that that our industry have faced in terms of you know, the standards and associated with privacy and also you know, payment related issues that may have hindered the development of telepsychiatry. I have in my office used the platform for about 5 years. My office is in a area that's sort of in the upper middle class neighborhood in Houston, and you would think that these you know, high functioning individuals who are very busy would adapt to telepsychiatry, but you know what, I think that they're used to coming into the confines of the secure setting to discuss personal emotional issues. And so leaving it to a lot of these high functioning individuals, they actually chose to come into the office rather than adapting to this technology that they're familiar with. So when Houston shut down, and we had to transition to telepsychiatry, we actually had patients canceling on us, that we rather wait until this pandemic is over before we see you, because you know, we just want to come in person. And so this concept of telepsychiatry was actually much more pervasive out in the rural communities, and you know, in a lot of these rural communities in Texas, you're used to seeing a treater via telepsychiatry. So it's interesting how the urban population had to kind of adapt to this modality of treatment, because I got to tell you, most of my patients really didn't want to do the appointment via the telepsychiatry platforms, and so that was a really interesting observation at the beginning of this pandemic. But yeah, as I said, the training wheels got yanked. off of telemedicine, telepsychiatry, and we all very quickly adapted to a certain new norm. And I don't know if we're going to go back now, because most of my patients are actually asking for telemedicine sessions.
Mm-hmm. Mm-hmm. Well, you bring up an interesting point in regards to how we adapt. I mean, one, when you said the higher functioning, that's to me, I always have to be careful when I use that, because I always think, even just myself, I mean, I'm high functioning right now, but maybe if I don't get my cup of coffee and my sleep in the morning, I am not that high functioning. So I think about that. The next thing that I think about is, as it applies to all of us, I think about, kind of the three main things that we're always thinking about in psychotherapy, and other authors have said it, but I definitely, in terms of those themes, what can you control, who are you, and what can you trust? All right. And if we're kind of used to having all of those things, and it's particularly the control part, where we have a set routine, that can cause a little bit of angst. We don't have to adapt in the way that we are accustomed to, or we don't have the same resources. So that's tough. And the next thing that I think about as you're talking about this is, for all of our population, all of us, is psychological flexibility. How flexible are we in terms of changing our coping styles? Going back to our earlier point with schizophrenia, I think that depending on one's lifestyle, the ways in which people cope or how they live because I'm sure we'll get some comments about this. I'm many different comments, but depending on how one copes, inherently that may give you a certain, if you will, easier ability to adapt to crisis than others. I mean, sometimes I think that with my patients that are, I was trained in New York as an example, and I had the fortune of working with many patients that had dealt with and who were homeless and knew how to survive very well without a number of things. Whereas I remember, I forgot what year it was, maybe it was like 2004 or whatever, that great power surge that dumped all the electricity out in the East Coast. And I was a fish out of water. I was like, whoa, what's going on? But some of my patients who were used to actually adapting with very little resources, they were fine. So again, I think as you talk, Dr. Chen, it really makes us start to think about, one, are all of our resilience, how we cope, as well as I think about psychological flexibility, and how we start to tap into those, all of us, our own underlying resilience, regardless of whether you have schizophrenia, bipolar, demoralization, burnout, you take it, you name it, so to speak. So Dr. Chen, I did want to come back to something, because you brought up something, and it was because you said you practice in correctional facilities also.
Well, I spent a brief amount of time in the early part of my career in a correctional facility, and it's basically, unfortunately, a correctional facility serve as the state hospital for schizophrenic patients. I had the experience early in my career doing that for a period of time.
Yeah, I was just curious if you had any, just because we're talking about the environment, we're talking about different things, folks that are in correctional facilities, and just kind of things that maybe concern you or that have been on your mind, because not a lot of psychiatrists, unfortunately, far to have experience in correctional facilities, myself included. So I think that the audience would be very curious about maybe any viewpoints that you would care to share with us.
I mean, I think that the unfortunate part about individuals with schizophrenia in correctional facilities is that they, number one, they may be under medicated, and so that leads to disaster. Oftentimes, the correctional facilities are very structured, and sometimes it is difficult for individuals with schizophrenia to follow very rigorous structure. I worked at a day program, for a period of time as well, and you're constantly having to redirect these patients, and the issue about having to redirect patients in a correctional facility is that they get redirected by correctional officers who usually will end up enforcing some very punitive actions on these patients. And so I don't think that certainly personally, I don't think that the correctional facility is the right venue for a lot of our patients with schizophrenia. But I think that in this COVID crisis, again, they're not very good at following directions, and sometimes social distancing. They're sort of in a cell, which is something that may be very familiar to them if they're by themselves, but they're certainly not enforcing the mask. They're not able to follow instructions in terms of masking. They're not able to follow instructions in terms of hygiene, and so that may work towards their detriment in the correctional setting. I think that going back to something that you pointed out earlier in terms of isolation, one of the unfortunate aspects of my life is that I did kind of grow up through my career in psychiatry with a brother with schizophrenia. And, these guys are really good at hiding in their rooms. I mean, they can social distance and isolate for days. So the pandemic doesn't seem like it's, that big of a deal when the instructions are social distancing and isolation. But in terms of talking about resilience, I think that this is a very unique situation for the individual with schizophrenia. This is one time where they can follow these natural directions, because these are things that are instinct. These are directions that are instinctual to them. I think that certainly they may not have the resilience in other settings because they're very concrete and they can't shift sets and they can't problem solve. So I think that this is a unique situation where they may actually kind of deal with a global crisis in ways that we are instructed to deal with. I do see a lot of individuals who are rattled as a result of some of the chaos in the world. Things are shut down. Their lives are not the same. They have the individuals who are really rigid and very structured have been thrown off as a result. I have patients who are used to going to the gym every day at 5 a.m, and all of a sudden, 3 months into the pandemic, they're wondering why they're feeling anxious and depressed. I have had patients who are used to going to Alcoholics Anonymous on a daily basis. And the loss of that structure was a detriment to them. And so it seems like flexibility in your ability to adapt to situations certainly is called for in a pandemic like this, where we don't really have a set of rules. We just kind of have to react and stay afloat.
Well, Dr. You raised some extremely valid points, and I mean, as you and I thank you for sharing your own personal story with us, and one in medicine in your own family, and as I think about this, and again, as I say, I'm going to say schizophrenia spectrum disorder for those in the audience that clinicians, providers that work with schizophrenic patients. I'm not trying to paint a picture that one size fits all. I'm talking about every patient is different. But as I hear Dr. Chen talk, these are some of the things that I think about. I think that some or a certain proportion of our patients, in certain ways, may be able to follow directions better than we do as it pertains to quarantining, but more maybe specific things such as masking and things of that nature, particularly in environments where they don't have the access or support, they may find that more difficult. I would add that would just join them with probably the vast majority of the population in this country when it comes to consistently masking and washing hands. So let's just put that out there. That's, if that's the criteria, that's America has a instruction problem.
Sure.
Yeah. So there's that. But then I definitely think about that. And then the next thing that I think about is, again, it goes back to, I think, access, support, and can we actually have environments, that are going to empower our patients wherever they are for them to best navigate this, because again, that's going to allow them to tap into their strengths. So whether or not we are leveraging family support, whether or not we are leveraging telehealth services, I've got Dr. Henry Nasrallah in my ear, whether or not we are considering giving long-acting injectables to our patients so that they don't, when indicated, so that they do not have to routinely go and get, prescriptions or go out of the way. If we're thinking about all of those things, I think that we're really helping all of us start to think about and focus on, again, it's an old model, but it's a good one, that circle of control or whatnot. The first circle is what can you control? The next one is your area of influence. The next one is your area of concern. And in the midst of this pandemic, we have to learn and grow from each other and really always be mindful of what it is that we can control ourselves. And we can not only learn from each other, but we can learn from our patients, which is why I say they're the source of everything. So in terms of our knowledge in medicine. So Dr. Chen, sir, I want to thank you for joining us on the Psychcast, and I want to leave you with the final words for our audience.
Look, Dr. Norris, we're going through something that probably every one of us who's alive have never gone through. Mm-hmm. There isn't a playbook in terms of how we come out of this this pandemic. But I think that we need to trust some of the experts on infectious disease. We need to trust some of the experts on infectious disease, and be able to feel that you have some control over aspects of your environment, so that we can all get through this without feeling that we're losing ourselves. I know that this pandemic has certainly introduced telepsychiatry to the world, and I hope that this is going to be a positive thing in terms of being able to engage with our patients more frequently, with more care, being able to see them in an environment where we're essentially doing home visits like the old days. And I want everyone to know that that we will come out of this as we all have. I want to share with the audience that we have, as a human population, come out of these pandemics in the past, and things will get back to some normality. So let's stay safe and stay alive.
Well said, Dr. Chen. Thank you for joining us on the Psychcast.